influenced by Professor M. K. Vishwanathan, Dr. Manu Kothari, Sir John Charnley, and Augustus Salmiando. I have a lot to share with the youngsters, but for time constraints, I am confining to three aspects. Intraarticular fracture around the knee, supracondylar fracture of the humerus in children, impactor fracture of neck of femur. Scene for conservative treatment made me set up Balcom beam frame in our hospital in 1988. Intraarticular fracture are to be anatomically reduced and fixed. It is rather a new concept propagated by AO. Earlier, they were treated conservatively with reasonable good results. Joint surface will be re-established by continuous movements. Fibrous tissue and bone undergo metaplasia to cartilage. Short strike, when you treat conservatively, it is insignificant. See the range of movement in traction. Do you expect a better ROM with surgery? This is initial X-ray. This is after traction. You can see I haven't put any graphs there. ചോദിച്ചത് തുറക്കാൻ പറ്റാത്തതിന് കാരണം പറയാൻ പറ്റില്ല അല്ലേ? ഇതാണ്. So this after traction, I haven't put any graph there, natural did it. That is the final X-ray, and nature made it back. So do you PowerPoint? So window again here. And this after traction, yeah, I haven't got any graph there. Nature did it. This is the nature has made some bone there. Okay. Final, nature made it into a mature osteophyte so as to avoid possible instability. Okay. Into a mature osteophyte to possible instability. This is Babu, 34-year-old taxi driver in front of our hospital. The staff in the hospital. Treated with the traction. See the range of movements. Yes. He is back to work in 4 months' time. 4 months' time. Yeah, this is the X-rays. 30-year-old male, history of fall from a coconut tree, plant or if patient not willing. Balcom beam traction. This is the X-ray when traction is removed. Then change to above knee cast with the hinge at knee. After 2 months, he came walking for plaster removal. He can bend the knee more than 90 degrees. After 10 weeks, patient pursued his job of coconut tree climbing after 3 months. Now the second situation, conservative treatment of supracondylar fracture in children based on different concepts. The limb that is kept in internal rotation by sling after reduction is the culprit behind the problem of close treatment without internal fixation of supracondylar fracture, because we are not immobilizing the proximal, that is the shoulder joints. The most important aspect in this method is to keep the limb in external rotation after attempted reduction and later maintain its neutral position without considering the accuracy of reduction in the check X-ray. I repeat, without considering the accuracy of reduction in check X-ray. Internal rotation can be avoided by keeping in external rotation after reduction and keeping the limb keeping it in neutral position till ROP. See this case, the malunited, but see the flexion at 6 months and there is no varus. Follow up at 8 months. Gross malunion in X-ray, but no problem for the patients. See, it is united, there is no virus. Totally unacceptable position in check X-ray. In plaster, this is the final result. But see the final result. Another case, very bad position and bad reduction, but this is the final. So much of fluxion. There is no virus. X-ray 1 month and 1 year after ROP, remodeling capacity of the body is so great. Clinical photo of the patient 1 month and 1 year after ROP, swelling totally disappeared. This is the swelling. You can see the swelling here initially, but it has totally disappeared. Now the third one, impacted fracture neck of femur. A 78-year-old lady, history of fall followed by pain in the hip on attempted to walk. Impacted fracture neck of femur, not because of the X-ray alone, by clinical criteria by Dr. Koshi. The criteria are no obvious external rotation, able to do active straight leg raising up to 30 degree, rotation of the hip are painless for 80% of the range as compared with the opposite hip, with the pain starting only at extremes. Patient was not willing for admission, hence domiciliary treatment is decided upon. Equipment used are 2 fluffy pillows, 2 lungis, some simple cloth strips for tying. Red pillow ties around the foot in U-shape prevent the external rotation. Green pillow below calf ensure elevation of the foot and mild flexion of the knee in order to facilitate quadriceps exercise. The fracture went on to heal uneventually and the patient lived for 8 more years being fully ambulant. I have treated 10 cases of impacted fracture neck of femur, all except one, united with excellent results. I treated them conservatively, not because of the financial constraints of the patient, but because I believe that is the best treatment. Rosie Abraham is my relative. I decided to treat her conservatively. After 6 weeks, after 3 years, she fell down again. This time fractured the left hip. Again valgus impacted. See the well-united fracture on the right side. After 4 weeks, X-ray of Veronica Chechi, my neighbor during childhood. Her son is a radiologist in Srijitra. Patient insisted to see me before undertaking any treatments. This is a fracture, impacted fracture. After 6 weeks, after 3 weeks, after 6 weeks. Points to remember when you undertake conservative treatment for fracture neck of femur with valgus impaction are no traction. With traction, the fracture will be disimpacted. Don't allow the limb goes to external rotation. Hip inflection between 20 to 60 degree. Convenient abduction but no adduction. At no stage patient is bedridden. Patient can sit with the legs down. Can use the commode provided there is somebody to hold it in the way described. There is hardly any pain. After 3 weeks, check X-ray. If there is no displacement, they can walk without bearing weight, provided they are otherwise healthy and can maintain the limb in the position described. Partial weight bearing after 6 weeks, full weight bearing after 12 weeks. Failure of this method can be detected easily. Patient develop pain, limb goes into external rotation. These clinical features are more reliable than X-ray. 2 more cases that I retrieved my collection before and after treatments. I end my talk showing a case of fracture both bone leg I treated recently. This boy from Guruvayur was an engineering student in Salem, where he sustained his fracture and was advised surgery. His father heard that I used to treat such cases non-operatively and took him to me. This is his X-ray in slab. On fourth day, I completed the slab, made him walk with the support. He was called back after 2 weeks. At that time, this was the X-ray. On weight bearing, initial displacement about which I have no idea become quite evident. That is to be expected. At this stage, I am sure nobody will venture to continue conservatism. But I did because the patient has so much of confidence in me. While giving PTB, when the callus is in a plastic stage, I manipulated to correct the angular deformity. Overriding and translation is totally neglected because I have to accept that. Patient has to continue weight bearing. This slide. This is the X-ray at the time of ROP. He continued weight bearing, initially partially full weight bearing within days. He went back to sports activities after this. I contacted him when I decided to revise my presentation. He was only happy to come and have this X-ray when I said, this is to teach young orthopedic surgeons about the effectiveness of conservative treatments. This is the latest X-ray he sent me last week just for this talk.